Everybody, welcome to Aesthetify India podcast. This is a platform where we delve into latest technologies in medical aesthetics. Today's topic is for the doctors who are starting their journey in the realm of dermal fillers. Before we start today's discussion, I would like to give you a perspective that why this topic was chosen for this podcast discussion. We've realized after talking to so many doctors, after organizing multiple trainings, that there is a learning curve for the new injectors, even after finishing their masters or their academic courses. So let's decode this learning curve with the help of our expert today, Dr. Soumya Sachdeva. She is an expert injector and she had been practicing aesthetics for a very long time now. So, without further ado, I would like to welcome you, Dr. Soumya. So, please start with your introduction. What are you doing currently, and what have you done as part of your doctor's degrees?
Thank you, Ms. Gunjan. Hello, everyone. I am Dr. Soumya Sachdeva. I am consultant dermatologist at founder at Theya Wellness Skin, Hair and Aesthetics Clinic. This is located in Kaushambi, Ghaziabad. I am also consultant dermatologist at Max Super Specialty Hospital in Vaishali. I have done my MBBS from Safdarjung Hospital in Delhi, followed by MD in dermatology from RML Hospital in Delhi. I have also obtained DNB in dermatology from National Boards of Examination, and I'm also ECPMG certified from USA. After my degree in dermatology, I've undergone multiple trainings, worked at multiple private and government setups, and then I've also started my own clinic located in Kaushambi.
Wow, that's so extensive so far, Dr. Soumya. So, let's start with you. That how did you get into this industry of injectables? What inspired you really to, make it a part of your aesthetics practice?
So actually, while I was in my dermatology training, I was actually always fascinated with the injectables, and I always wanted to learn injectables. So after finishing my training, I made it a purpose that okay, I have to specialize in injectables. I This is what I am passionate about, and I want to do it because the ability to change the appearance of a person as per their liking, to help them with their own self-esteem, is very gratifying, and to be able to give those results is a very gratifying experience, and that is what fascinated me, and I was very passionate to enter into injectables. That is why I decided to jump right ahead into the field of injectables after finishing my training.
Okay. So let's go back a bit and understand that for you, how did you start the learning process for injectables? What kind of courses did you pursue? What all platforms did you go to get a hold and to get an expertise in this field?
Yeah, so after finishing my training in dermatology, first thing that I did was I have read almost all books that are available on injectables. All books on botulinum toxins, fillers, threads. I don't think any book is there that I have not read, and there are multiple PubMed articles, MD codes, everything I did read, and after that, and in addition to that, actually that goes went side by side, and I underwent multiple trainings. So we have our own conferences of dermatology where we have hands-on workshops. That's where I started. That was my starting point. I used to attend the hands-on workshop, listen to the trainers who are teaching. Then I went on to attend seminars, one-to-one workshops, hands-on workshops, seminars, CMEs, professional developmental courses, and finding mentors. So it has been a long journey and a very fulfilling one.
Wow. Also, I would like to understand that anatomy plays a very important role. And do you really need to brush up your anatomy before, even after completing your dermatological degree?
Definitely, facial anatomy is important when you're injecting. So, assessment of the patient assessment and facial anatomy play an important role in being able to be a good injector. So, that is where your education also comes in. That you have to educate yourself. You have to keep learning, keep in track with the newer developments in the field. This is an ever-changing field. You can never say that I know everything. There's always new things to learn, and you have to keep upgrading yourself.
That's very interesting, and I think it will give good insights to the new people who are learning these courses. Now, my next question is that we are seeing a lot of doctors are upscaling themselves. We see that they're attending so many workshops, hands-on, cadavers, but even after doing these courses, they are still hesitant. They're still skeptical that whether injectables will work for them. They do not have that amount of confidence for that. What do you think is the main reason behind that?
Definitely, that is there. I see this a lot. I see people attending trainings, and year after year, they are attending every possible training
Mm,
available, and they do know their stuff,
mm,
but still, they are not able to take that first step
mm,
and to enter into the field of injectables. So, that first step has to be taken, and this is where the hesitancy comes from.
mm,
And why is this hesitancy there? This hesitancy is there because the dermatologists and the plastic surgeons, they feel that maybe we are not able to give that desired result that the patient wants. What if it does anything to our reputation?
mm,
What if some complication happens? So those what ifs that run in the mind when you are going into injectables is what stops a person from entering right away into the field of injectables. So the most important thing here is to take the first step. Once you are well armed means everything put together, having using a good brand, having the requisite knowledge, having the requisite skills, taking the adequate training, having mentors. You have to take the first step. Unless you take the first step, you will never be able to go forward. So you have to start somewhere, and that is very important. You must have that courage to
mm.
start off. This is a very important message that I want to give to young and new injectors who are right there. Please, if you are well armed, you must start off there. You must build up the courage and start by finding some volunteers. You can also start off by you can also start off by having lesser profit. It's okay. Initial set of patients, you don't have have too much of profit. That's fine. You can also start off with your family members. Somebody is interested, but you must start off somewhere.
That's very important and a key takeaway that must start somewhere. So, ma'am, my next question to you is finding a volunteer is a challenge. We know that. Okay, you've arranged a voluntary patient, or maybe you're doing it on a family member, but still, you don't want to do it standalone. You don't still feel very confident. And I don't think that will be very appropriate also as a doctor, or not very responsible also to do it completely by yourself when you are not sure about it. So, in those scenarios, what is your suggestion?
Yeah, definitely. I think the initial one or two patients that you're doing for every indication,
Hmm.
you should at least try your best to have somebody who has mentored you to be there. Just be there in
Hmm.
during the procedure as a silent observer, so that you have that confidence. Also, if you are going at the wrong angle or
Hmm.
injecting wrong, so they can guide you. It's
Hmm.
just a little bit. Once you know everything, you have the appropriate machinery in place. It's just a little bit tweaking that is required, and that
Hmm.
that is provided by somebody who is your mentor or somebody who's your colleague or
Hmm.
friend. They can be there, and that is a good approach
Okay.
for the initial set of patients.
Right. That I think will be a right approach to start.
Right, right.
Okay. And what do you think is the role of the right product, and especially identifying the source of the product in this whole, process?
Definitely, the importance of associating with a good product, a good brand, cannot be under thought of. Because a good brand, a safety level, the quality, and whom you're obtaining the product from is very important. Whether it is an authorized person from who are you are taking the product. These days, there's so many duplicates in market. You don't know. So you must obtain the product right from the person who's actually into the manufacturing, or who's the one who's actually the authorized vendor for the product. And the product should be of you should look at the product, that is it having good results, is the quality good, is the safety record good, is the track record good. These things have to be kept in mind. And if you invest in a good product, and that is actually going to play a long and a big role in building your patient trust, actually. Because your trust is built on good reviews, doing good work, and choosing a good brand is very important in that.
Right, rightly said. So now let's go and talk about your own practice now. So I will raise a topic which is very dreaded in injectables: complication. And complications can occur any to anyone and anywhere. So I want to understand from you, has it happened in your practice? And if it has, how have you dealt with it?
Yes, you cannot run away actually from complications. So complications are of two types. One is the very dreaded complications, and one is the general complications and the minor complications that do happen. So you have to be equally prepared for both. When you talk about minor complications like redness, swelling, bruising, these things can happen. And when you are investing your time initially in building a rapport with the patient, you must make the patient aware of everything about the procedure, about the post procedure complications, and these things can happen. So investing that initial 1 hour when you are talking to the patient, when you are assessing the patient's face, you are making them aware about the procedure, that goes a long way in building the rapport and the trust, and where you've explained that these things can happen post procedure, so then the patient is not going to be alarmed that, oh doctor, this has happened, and also you are equally prepared to deal with it. Now we talk about the worst complications, the dreaded complications, like some kind of allergic reaction has occurred, some worse complications have come up. So you must have emergency systems in place, and for that I also want to mention that when you start off your procedure, you must take an informed consent. That is also very important. Proximity to a hospital is important. Having stuff like adrenaline injections, steroid injections, antihistaminic injections, these should be available at your practice. So suddenly you cannot run and make them available. So these things are very important, and never underestimate the importance of these things. These things, these kind of dreaded complications are very rare, but you never know when it happens with somebody, and you have to be prepared for it.
Yes, prepare well is the key
Right.
then. Okay, now let's also delve a bit into the marketing side of the practice. We know that competition is at its peak right now. More and more people are joining aesthetics and also injectables, which is even more specialized field. So, what are your tips for the new practitioners? Because they want to understand that how to create that kind of affinity with the patients, because being a new injector you'll have lesser database, lesser case studies to showcase. So how are you managing that in your, how did you manage that in your practice when you started, and also what are your ready tips for the new practitioners?
So definitely competition is always there, and whenever you start anything, there is always competition. We should not be scared of the competition. If you have your own knowledge and education in place, and if you feel that you are lacking somewhere, educate yourself and then get the requisite skills and expertise. Now it comes to when the patient comes to you, you must invest initially 45 minutes to 1 hour, where you have a time, especially for the injectable patients, where you actually build rapport with the patient. So there you are discussing patient's expectation, you can do a full assessment. So it is, when we talk of injectables, it's never one thing actually.
Mm,
You should assess the face and tell them that actually you need all these things for the desired result, what you're looking for. First of all, you should understand what is it that they are looking for.
mm,
Sometimes they themselves don't know actually that
mm,
what is it that is going to be corrected with
mm,
what. So understanding their expectations, then there are budget issues also of the patients. You can tell them, you start one by one, let's start with this one thing
mm,
first, and then you can do the next thing over the next month or next couple of months. So that
mm,
ways, investing time initially in rapport building, so that the patient knows what they are getting into and what to expect,
mm,
is very important.
mm,
Then of course, having your own case studies of your patients where you can show the before after results
mm,
is going to help you. If you are in the very initial set of patients where you don't have it, so you can always get those from brands.
mm,
Brands you're associating with, they have their own set of before after patients
mm,
with that particular brand, so you can always showcase those, that this is the result that we are expecting. If you have a mid face filler, then this is what you will expect.
mm,
If you're under eye filler, then this is what you will,
mm,
kind of result. So they have their expectations in place. Sometimes the patients have very high expectations, or they have some other thing in, so that is very important to clear it beforehand. Also, you must take proper pictures of the
mm,
patient. So many times I've noticed that suddenly after getting a procedure, the patients will start noticing their face a lot, and then they'll notice something that this has happened, which was actually already there.
mm, mm,
And the right and left profile are never the same
mm,
of anybody,
mm,
but this thing happens, then they'll say that why this thing is like this and this thing's. So initial, you can then show them the before picture, that it
mm,
was like this only to start with. Your right and left side are not the same. That kind of asymmetry was there in your face
mm,
previously, and whatever. So that way it's important to be well armed. You should be well prepared that these things can come up. And that is why the mentorship and training is important, so that when you start off you have everything in place.
Yes, absolutely. You've rightly said that I have seen our volunteers also noticing their face more and more after getting the
Yes,
treatments done. So
it's
they
all
are
there.
now looking on the things which they've never realized were
Yes,
existing.
yes.
So before we wrap up, I want to touch base upon a very important topic, and especially when we are talking about medical industry, trust. We all know that trust is not a hack, and it has to be lived every day. Especially being a doctor, it is such a responsible and noble profession. So how you are building onto that trust, and what are your inputs for the new practitioners also, because this is one thing which we firmly believe as a company that you cannot ignore.
Well, building trust of the patients with yourself is very important, and that actually comes from your own self. That you should have your own morals in place. You must do your practice in an ethical manner and be honest to yourself.
Mm.
If you are honest to yourself and do everything in a good way, use good products, invest in good quality, do everything in the right way, that trust is built over time. And then of course it is also important to have open communication with the patient, give time to the patient, be approachable. Approachability is very important. Sometimes I see some doctors with very heavy practices, they are doing good work also, but sometimes the patient, it is difficult for them to approach the doctor. They are not able to get into touch with the doctor for weeks together when
Mm.
they have some minor concerns. So if that thing should be there. So if you are busy, your staff must have a system in place where they can get in touch with the patient. And if the patient would like to talk to you, should have some time where you can give some time, because when patient goes for injectables afterwards, sometimes they have concerns and they have queries. Doctor, this has happened, that has happened. So being there,
Mm.
to listen to their query is also important, and that builds the trust, and that thing is very important. And it goes a long way. Even if your patient has had a minor complication, but you've been available and you've been there to listen to them, they'll never complain. So that is there, that is very important.
Yes, absolutely. So, thank you so much, Dr. Soumya, for such an insightful discussion today. I'm sure this will motivate a lot of new practitioners to enter into the field of injectables.
Thank
So, this was our first podcast, and we will be coming up with more and more interesting topics, bringing in experts from the industry. So, please like, follow, and connect with us so that we can bring in more useful content for you. Thank you so much.
thank you.